I've really liked it so far. I didn't really know what to expect kind of going in, but my expectations have been exceeded in every department so far. I love my preceptors. I love my patients. I can see them in different settings. I've gotten to know them a lot better than I think I would have otherwise. It's a little bit challenging with kind of getting, the learning curve is a little steeper, I think. You have different specialties every day almost of the week, and so you're kind of spread out that way, and you have to balance what you want to learn when. But I think managing that after getting a control of that, it's a good experience. I think it'll be really great at the end.
I spend my white space in a couple of specialties that I'm interested at some point pursuing as a career or learning more about in the meantime. First is cardiology, and I think, first of all, I think white space is fundamental for a medical student to explore their interest on their extra time. And in cardiology, initially I got to see patients who present with a numerous presentation of cardiac issues, whether it's exercise intolerance or pain, chest pain that is, or nocturnal dyspnea, and what are the procedures are. Either they get an echo or ultrasound or medication changes, and how long they follow up, or if it's a benign presentation. So I got a good preview of what that specialty is like. And later on, what I'm planning on doing later this year is going to cath lab and see some of these patients going through either pacemaker insertion or placement, or a stent placement, and how they go through this process for their cardiac problems. I think that's what white space is for for a student to develop an understanding of something they're interested in. Other things I'm interested in white space that I spend time is vascular surgery. First of all, it's one of the surgical specialties that I'm interested in, and also it's very tied to cardiology. So for me, it's very interesting because both fields focused on a lot of stenting, open procedures for vascular surgery. So and I got to meet a lot of great people in both of these specialties. In vascular, for example, Dr. Dadian, great person, teaches a lot during his surgery time, and I initiated all this pursuit of learning about vascular surgery. So this kind of reflects on my interest level, I think. And in the future, when I interview for any of these specialties that I'm interested in, I could argue for my qualifications to get a position in one of these specialties, because I've expressed interest, I followed, and maybe done research at some point, and the physicians know that well that I work with, and then they can write me a good letter of recommendation, or they can support me in a way to get a good residency or vouch for me for my interest level. So that's what white space meant for me.
So this is something where I think I really enjoy the LIC program. I met a lady who had type 2 diabetes. I met with her during an annual wellness visit, which is basically our chance to do all the primary prevention care we want to do. So diabetes is a pretty common thing this day and age, and you kind of see a lot of it. But the flexibility of this program allowed me to kind of stop what I was doing the rest of the day and follow her to her care manager to see what that's like. And with her permission, I can see what type of mental health support she gets, what type of nutrition support she gets, and basically all the different people who are trying to help her.